Hi, my name is Brian Opferman, and I'm a rising third-year resident with the UMKC Emergency Medicine Residency Program. And I will be presenting my poster, PA Student Point-of-Care Ultrasound Skills for Diagnosing Acute Cholecystitis, Simulation and Hands-on Education to Safely and Successfully Assess Patients. Some background about the project. Abdominal pain is quoted as the third most common complaint for patients presenting to the emergency department. Of the many reasons for abdominal pain, biliary pathology is a frequent cause. It's thought that cholelithiasis affects up to 20 million Americans, and up to 20% of those people go on to develop symptomatic cholecystitis. This leads to over 1 million hospitalizations and 750,000 cholecystectomies annually. The American College of Radiology recommends ultrasound as the initial diagnostic imaging evaluation for patients with right upper quadrant and physician suspicion for acute cholecystitis. And acute cholecystitis accounts for up to 11% of hospital admissions and is associated with up to 0.8% mortality. And as such, it's a very crucial diagnosis to make in the emergency department. Bedside ultrasound provides a fast, reliable, and cost-effective tool for the diagnosis of cholecystitis. And the use of point-of-care ultrasound, that I'll be abbreviating as POCUS from here on out, has been supported in a consensus statement by the European Society of Trauma and Emergency Surgery. And multiple studies have actually shown that trainees can accurately diagnose acute cholecystitis with good inter-rater reliability when compared to sonographers. So POCUS has been shown to reduce emergency department wait times by nearly 2 hours to diagnose cholecystitis when compared to imaging performed by the radiology department. So with the background data we have, there may be a way to reduce redundant radiology studies and thereby decrease costs with the further implementation of point-of-care ultrasound. And that change can happen by spreading the number of trained professionals among specialties, including physician assistants. So there were studies that saying that about 23.4% of PA schools had incorporated an ultrasound training program. As these numbers are rising, some limitations for other programs not implementing them was related to timing in implementing in their curriculum, as well as access to equipment. So the purpose of our study was to utilize an online didactic course through the technology known as SonoSim, as well as a hands-on point-of-care ultrasound training session for the University of Missouri, Kansas City physician assistant students to use ultrasound to rule out sonographic acute cholecystitis as evaluated by a checklist post-test. I want to direct your attention down to our educational curriculum, which essentially was divided into two parts. Part one of the curriculum started with an online didactic portion offered through a computer-based simulation platform known as SonoSim. And students were provided this and were sent modules about a month prior to our in-person workshop. The assigned modules consisted of interactive lectures from the fundamentals of ultrasound, biliary tree anatomy and physiology, and intestinal biliary core clinical. And each of these modules was finished with a medical knowledge test that must be completed prior to our hands-on workshop. From there, students then received a pre-workshop survey, which tried to quantify, one, their prior exposure to ultrasound, and gallbladder ultrasound specifically, and from there, the sonographic signs of acute cholecystitis, such as pericholecystic fluid, gallbladder wall dilation, and the presence or absence of cholelithiasis or gallstones. This pre-survey also included Likert-type questions that allowed the PA student to rank their self-perceived confidence when it comes to POCUS skills. The second part of the curriculum involved the hands-on skills workshop, which again kind of was split up into multiple parts. The first station of the hands-on skill session just allowed the students to familiarize themselves with the SonoSim scanning technology. So they used their personal laptop that had the online SonoSim software downloaded, and they ran through some practice cases. Up to 8 cases were available, a few of which started with normal anatomy, and then a few that included biliary pathology. And over on this side of the screen, we can see some of the images obtained using this technology. And this is all connected to their laptops. From there, they went on to Station 2, where they were assigned a partner, a fellow PA student, and were able to practice visualizing the gallbladder on each other and would alternate who would work as the patient and who would work as the scanner. And then from there, they went on to Station 3, which included this one-to-one checklist-based exam. And this particular checklist was developed prior to this station through conversations with multiple ultrasound trained and familiar faculty to really determine what would be the most important step when using point of care ultrasound to diagnose acute cholecystitis. And after multiple rounds of edits provided by some of these professionals, we had settled on this particular list in front of you. And this list, the PA students were paired and again would alternate who would act as the patient and who would act as the scanner in a formal simulation where the grader, the person that was designated to score them with this checklist, who was an emergency medicine resident trained in ultrasound and tried to keep it objective based on this scale. They were provided a prompt essentially describing a clinical situation indicative of acute cholecystitis, and they were tested with scanning for or verbalizing findings as seen on this checklist. And with this checklist, you will see that there were areas that BPA students did very well and some areas that required a little bit of improvement. And some of those areas that required improvement would be the modesty, the verbalizing that they are fanning through both planes of the gallbladder image, and then whether or not they had identified pericholecystic fluid. And then this checklist data was combined, and then students received a post-workshop survey, which again had them rate their competence in identifying sonographic signs of acute cholecystitis, a lot of which were detailed here, including the wall thickening, the pericholecystic fluid, the presence or absence of gallstones. And this post-survey also included really their perception of this particular workshop and if there was agreement that this was a good experience overall. And that post-event survey, all students agreed or strongly agreed that the course provided a supportive learning environment should be repeated in the future. And they felt that practicing on a live patient was a valuable part of their curriculum. So in conclusion, as we stated, the students were very satisfied with the curriculum and reported confidence with their gallbladder ultrasound skills improving from pre to post test. Some limitations of this study, one would be the number of students that we had incorporated. We had used 13 of 17 final year UMKC student volunteers. So possibly in the future we could expand that number. A second limitation would be some variability in the anatomy of the patient or the students acting as patients when performing the gallbladder exam. Future studies could incorporate a standardized patient to ensure that everybody had the exact same scanning experience. And these future studies may also tried to correlate learner simulation-based performance with patient care outcomes, such as ED length of stay, and whether or not the use of point-of-care ultrasound truly reduces any unnecessary CT scans. So in short, I was very happy with this project. I'm very excited about the results and more excited about the potential future implications when it comes to implementing a point-of-care ultrasound program in a PA student curriculum and translating that into patient outcomes after this training. Thank you.